My name is Lowo Adeyemi, and this is Design for Recovery, a global platform where design intersects with dignity and where architecture becomes more than a physical framework. It becomes a vessel of compassion, comfort, and care. Today's episode is one of the most tender and profound conversations we can have in healthcare design. Pediatric palliative care, designing for compassion. Let us acknowledge from the onset that pediatric care is a subject that resonates profoundly at the most fundamental human level. It compels us to confront the harrowing reality that some children endure life-limiting illnesses, conditions for which medical science offers no remedy. Yet, within this painful truth reside an equally potent affirmation. Design has the capacity to cultivate environments where every moment holds significance, where joy remains attainable, where dignity is upheld, and family receives support throughout the most arduous journey of their lives. Today, we shall delve into how architecture and design can manifest compassion, not in an abstract concept, but through the very spaces, hues, configurations, and intricacies that define pediatric palliative care setting. Let's begin. Before we delve into design consideration, let us first establish a clear understanding of what pediatric palliative care genuinely entails. Palliative care is not synonymous to capitulation. Rather, it signifies a pivotal shift in focus. For children grappling with life-limiting or life-threatening conditions, the emphasis transitions from mere curative efforts to the enhancement of comforts, from prolonging existence to enriching the quality of time that remains. This approach embodies holistic care that addresses not only the physical pain but also encompasses emotional, spiritual, and psychological dimension. Moreover, unlike its adult counterpart, pediatric care must accommodate the essence of childhood itself. Even amidst the challenges of illness, children are inherently children. They yearn to play, laugh, learn, and experience the marvels of life. Families wishes to see their child's humanity celebrated rather than being reduced to a mere diagnosis. This is where environment assumes an indispensable role. A sterile clinical space can exacerbate the feeling of fear and sorrow. In contrast, a meticulously designed environment can convey warmth, alleviate anxiety, and cultivate a moment of joy, however ephemeral they may be. So, the question is, how does compassion manifest in the realm of space? To answer this question, we must consider some highlighted factors. The first is child-centered design. Compassion within pediatric palliative environments necessitates the creation of spaces that resonate with the essence of childhood, not merely domain of medicine. Playful hues, captivating morale, tactile texture, and interactive features all serve to remind children that they are so much more than their ailments. Even a modest nook, furnished with toys, art supplies, or a reading corner can affirm a child's identity and individuality. The second factor we need to consider is the family-centered design. Palliative care transcends the individual patient. It envelopes the entire family unit, patients, siblings, grandparents alike bear emotional burden of illness. Families require private suites where they can reside overnight, communal kitchen area for preparing meals together, and dining spaces that foster gathering reminiscence of home life. These thoughtfully designed areas reinforce the notion that they remain a cohesive family rather than a mere visitor within a clinical setting. Nature integration is a third factor. Compassionate design invariably seeks to incorporate elements of nature, gardens, outdoor terraces, and windows that frame verdant trees or expansive skies infuse a sense of tranquility and continuity. Amidst the uncertainty of medical circumstances, the presence of nature gently alludes the rhythms of life, anchoring both children and families in reality that extend beyond the confine of the hospital. And the fourth factor is sensory consideration. Children grappling with advanced illnesses often exhibit heightened sensitivity to light, sound, or touch. Stark lighting, jarring alarm, or abrasive texture can easily induce stress. In contrast, soft illumination that emulates natural cycle, tranquil acoustic, and comforting textures cultivate a sensory environment that soothe rather than exacerbate anxiety. We must know that compassion expressed through spatial design involves not only the addition of thoughtful elements, but also the deliberate removal of institutional harshness, barriers to togetherness, and visual member of medicalization. Now let us consider the practical strategies that architects and designers can employ to instill compassion within this environment. The first of those strategies is achieving privacy and togetherness. Families require versatile spaces that can adapt to various needs. A room may need to be serene, secluded for intimate moments, yet also open to accommodate extended family or friends. Implementing sliding partitions, movable furnishings, and layered spatial design empowers family to tailor their environment as their requirements evolve. The number two consideration is integration of ritual and memory spaces. Palliative care frequently encompasses profound moments of reflection, spiritual practice, and remembrance. Spaces meticulously crafted for rituals, whether sacred or secular. These afford the family and the staff the opportunity to process grief and honor. Memory walls, legacy art projects, or even simple alcove or lighting candles enable family to forge meaning amidst loss. The third strategy is the integration of play and creativity. Indeed, even within palliative care, the significance of play cannot be overemphasized. Art therapy rooms, musical spaces, or even gardens that are equipped with swing and sensory play areas serves as a vital outlet for joy. This environment reminds children that their identity is not solely defined by illness, while also providing siblings with an avenue to navigate their emotions. The fourth consideration is the inclusion of wayfinding with dignity. Navigation elements in pediatric palliative care should be gentle, intuitive, and devoid of clinical starkness. Rather than relying on harsh signage, consider employing color-coded pathways, whimsical icons, or artful representation that guide families from one location to another. This thoughtful approach alleviates navigation challenges during stressful moments and diminishes cognitive strain. And the last consideration is about the staff well-being. We must not overlook the caregivers, the physicians, nurses, therapists, and even support staff who accompany families on this journey. Pediatric palliative care is emotionally taxing. Staff require designated respite area, tranquil rooms, gardens, or lounge where they can decompress, reflect, and rejuvenate. Supporting staff well-being is in itself a manifestation of compassion. Where caregivers are sustained, family receive enhanced care. Let us look at few life case studies. Across the globe, we encounter inspiring instances of pediatric palliative environments that are meticulously crafted with compassion. In the United Kingdom, Children's Hospice often harmoniously amalgamates clinical care with the comforting ambience of home. Rooms are adorned with vibrant colors, playrooms coexist with therapy suites, and gardens serve as an integral component of experience. Families are encouraged to remain as long as they require, with kitchens, lounge, and even designated spaces for sibling play thoughtfully designed for their comfort. In Canada, certain pediatric facilities seamlessly incorporate art therapy and musical spaces directly into the caregiving environment. They recognize creativity as an essential facet of holistic healing. Also, in various regions of Africa and Asia, where resources may be more constrained, community-based palliative care relies on multifunctional spaces such as church halls, community center, or even outdoor courtyards that are transformed through intentional design into sanctuaries of care, remembrance, and unity. This example reminds us that compassionate design does not necessitate extravagant budgets. Rather, it demands deliberate intention. The overarching lesson gleaned from these diverse examples, whether we are employing high-tech solutions or low-tech alternatives, operating on a grand scale or within the confines of community, design becomes truly compassionate when it prioritizes people over processes. As we draw to a close, let us engage in a moment of introspection. Pediatric palliative care transcends the mere prolongation of life. It is at its core about enriching the moment of existence for children, for families, and for those who provide care. Compassion in design is not an abstract notion. It is a tangible reality. It manifests in the family suites, where parents can find solace in close proximity to their child. It resides in the garden, where a sibling can revel in laughter on a swing. It is present in a tranquil alcove, where the caregiver can kindle a candle. It flourishes in the staff lounge, where a nurse can exhale after a grueling day. At its pinnacle, architecture venerates life, even in the shadow of death. Therefore, I extend a resounding call. As designers, healthcare leaders, and agents of transformation, let us approach pediatric palliative environment with humility, sensitivity, and boldness. Let us create spaces that embrace both joy and sorrow, that honor both play and grief, that enable family to feel supported throughout their most adult journeys. Ultimately, pediatric palliative care is not solely about endings. It is about presence. It is about love. And through the medium of design, we can render that love visible, tangible, and everlasting. Thank you for accompanying me on this episode. If today's discourse resonates with you, I encourage you to share with colleagues, leaders, and anyone influencing the realm where compassion is most essential. Together, we can cultivate healthcare environments that not only deliver care, but also embody its very essence. And until next time, remember that design can be an act of compassion, and in palliative care, compassion is everything. My name is Lowo Adeyemi. Thank you for listening. Goodbye.